Good evening. I'm Classy Lady. Thanks for viewing my channel. I am a new content creator and reaction channel. I'm 10 weeks in. For the people that are new that may come across my channel, the thing to do would be to hit the thumbs up button or the three dots in the corner, and it'll change where you can hit the thumbs up button. If you would like, I would appreciate if you subscribe to my channel. I do have over 200 shorts and lives posted. They are titled like this one is today, and you can pick and choose whichever one that you choose to look at. Okay, person. If you the same person, can you hit the like button for me again? I'm sorry. I had to restart my live. Thank you. I appreciate it. Thank you. Hey, ADHD, how you doing? I guess you the only. Well, there's two people watching me now. How you doing today? Yeah, whatever. I wish you were a new sub. Then that mean I get a chance to get another person. That would be nice. I'm coming along. I'm real close, but I just ain't hit it yet. Sometimes it's up and down. I had one live that I did. I don't know what the topic was. I'm going to have to go back and see. I had 23 new subscribers on that particular live. So it just, I guess whatever catches a person's attention and when they're watching and the overflow of people that comes in. You're not insane. I do know who's insane, but you're not insane. You just have a quirky sense of humor. Or you just have a quirky sense of humor. So you're not insane. But I thank you for always coming over and supporting me. I really appreciate that. Really appreciate that. I'm sitting over here going through mail. Thank you. I appreciate that. Yeah, that's what I say. People worry about how many people are in their chat while they're on. You talk to whoever is there. And if there's nobody there, you still talk because you never know who's viewing your channel. Or the people that's out there in the atmosphere that, that's watching. I appreciate everybody. Everybody don't want to, drop down in the channel, which I wish they would and just say hi. But you can't make people do anything. If they want to stay in the bushes or in the nosebleed section and watch, I don't have a problem with it. I really don't have a problem with it at all. Okay, so I'm at my second. Hey Gloria, how you doing? Welcome to Classy Ladies channel. I'm a new YouTube creator and a content creator and reaction channel. I'm 10 weeks in. I'm trying to get to that first 1,000 subscribers, and maybe even the 4,000 subscribers. So if you're new to my channel or you just viewing my channel, You know what to do. The new people, hit the like button, which is the thumbs up button, the three dots, or double tap the screen. If you hit the three dots, it'll take you over where you can hit the little bell and you can subscribe to my channel. If you're new and you don't know how to subscribe to a person's channel and you would like to come back. I do have over 200 lives and shorts posted. They are titled. I would like for you to go through all the shorts and look at them. And I would also like for you to, engage in my chats, my lives. They're very interesting, and we've had some good conversations on there. Hey, loving my grandsons, how you doing? Thank y'all for coming over. Make sure y'all hit the like button. Gloria, I remember, baby, when I say strange things, I remember to get that shirt. Here's the shirt. Now, you tell me where you see some sequins on here or some rhinestones on this shirt. I think this is the ugliest shirt that I ordered. I started to put it on just to see if y'all would like it. These colors look like they just threw some paint together. Not any sequence on here. No rhinestones. No nothing. Just a t-shirt with some ugly colors. And why I say it's strange, because when you look at the picture before you order it, these colors are bright, vibrant, all of that. That's what attracted me to the t-shirt. It's supposed to be a t-shirt sequence shirt. Ain't nothing of a sort. Those are all the colors. Look like they just took a paintbrush and just throw some colors together. No razzle, no dazzle, no bedazzle, nothing gonna be dazzled. Nothing. Yeah, nothing. So, I don't even think it. Hey, Valentine, baby, how you doing? Did you see the shirt, Valentine, baby? The shirt that I told y'all that was ugly that I ordered? I just showed it. This is it. No razzle, no dazzle, no bedazzle, no nothing. Just look like somebody throws something together. It was supposed to be with sequins or glittery or some stones on it. I didn't get a stone on it. I guess the stone is these white little things in there. I don't know. So anyway, when I gave them a review, they got a 1 star, and I told them that was the most ugliest item that I have ordered from them. And they asked me if I wanted a refund. I said, yeah. Hey, Kiss This Ring, how you doing? You must have snuck on in here. I don't see you. Oh, yeah, you snuck on in here. Yeah, and so I thought that was the most ugliest shirt that I ordered. And so they asked me if I wanted a refund. I told them, yeah. And I was going to, take it back to the post office to send it to them. They gave me a refund and said, don't worry about sending it back. I want to say, I can imagine. You probably got a whole bunch of them back, or people probably don't like them. But yeah, I thought that was funny. That was that Temu order that I had. Not this one that I just got, but the other one that I had, the last big order that I had when I had different trinkets and stuff in there. And I saw that, thought I was getting me a nice shirt with some nice bright colors for the fall in case I went somewhere, because it was supposed to be sequins. So in case I went somewhere, I had white sequins pants that I could have wore with it, or I could even put it with black. Child, wasn't nothing of a sort. So they didn't even want it back. But as long as they gave me my money back, I don't care. Like I said, that'll be a car wash shirt. And I'm almost scared to take it, wear it to the car wash. Let me see, Yo-Yo, you dropped up in here. I don't see Yo-Yo. Or were y'all saying yo? Yeah. Oh, yo, kissed the son. ADHD, I'm going to put you in timeout. Hey, Beverly, how you doing? Welcome everybody over. I titled mine Strange Things, but that was one strange thing what I showed y'all about the shirt. Other strange things that I was thinking about, I take a muscle relaxer. And this happened twice to me, probably within a week, or I'll say within a 2-week time period. I notice if I take it during the day, I kind of have a lightheaded or dizziness, which that's one of the side effects or whatever. But I take it at night. And so I've noticed that, like, I be, when I'm half asleep or whatever, and then when I know I'm getting ready to, turn the TV off and everything, use the restroom for the last time and get in the bed. And so I'll take the medicine. So wasn't last night, it was the night before. The medicine had me like I was reaching for something. I was doing this. I was, it's like I was asleep, but I was half woke. And I know I had gotten in the bed, tucked in, didn't have no reason to get up out the bed. I have water, my snacks is at arm reach if I need it. Water, I had used the restroom and everything. I was reaching and ended up on the floor. Fell out the bed on the floor on my right side. I'm like, oh my God. And when it happens, it kind of shakes me to kind of like wake up. But then I end up going back to sleep. Hey, BCU, how you doing? It's Misty Green in Houston. Oh, okay. Welcome over. Hey, ex-granny. So, yeah, and it had me like I was reaching for something, and I wasn't woke, like I was reaching, and it wasn't there. And I reached, did like this, and my body shifted and hit the floor. So I was like, it had me thinking. And then I'll fall back to sleep. I hit the floor, realize I'm down there, and I'll stay there, and then I'll stay there for a few minutes. Sometimes I'll go back to sleep. And then when the floor get hard or I get cold, I'll wake up. And then I'll be like, where am I at? And then I realize, girl, you on the floor. You ain't even in the bed. So then I have to wake myself up. I make sure I wake up all the way because I don't want to have a mishap and do it again. And then I get in the bed. So I did it. Let me see. The day is Saturday, Friday. I did it Thursday night. It made me like I was reaching for some gum. And I know I told y'all I stopped chewing bubble gum. So I don't have any bubble gum. But I was reaching for some gum. Or I was reaching for something. And it made me seem like it was there. And then when I reached, kind of like reached down, hit the floor. So today I was thinking, I'm like, this is strange. I never used to do this before. And I said, you know what? I say, I had 2 medications to change. So I'm Googling the side effects. So when I Googled on one of them, had no type of that as far as side effects or whatever. The other one I'm like, well, God dog, this muscle relaxer ain't too good for me. I've had muscle relaxers, and I think I asked this doctor to give me what I was taking, and he said somebody he don't prescribe that, and I'm like, you don't prescribe that, these pain management doctors, and I said, well, maybe I'm due to get some injections at the end of the month before I go on my cruise. And I'm going to see how those injections work and how long they work. Because if they don't, and I'm still going to be working on probably a neurologist with my nerves and see why I have 4-pinch nerves, but to see what else could be done. Because the pain management doctor, they don't want to really give you medicine. They want to manage your pain. And if anybody have had any back pain or nerve pain, have taken gabapentin, that medicine is trash. They want to give everybody the same medications. And I tell them, I am not like the next patient. I am truly not. If you review my story about having a heart attack at 30 years old, that's not a normal person. That's not a regular person that you can do the same routine thing to. And it's not only that, I've had other things that happen that, that don't make me like a routine person or whatever, or you could just give me anything. Because my foot doctor, I had to tell him that. And because one time he took me into surgery, and I told him, I say, you can't treat me like the regular patient, how you do the regular patient. I say, I'm different or whatever. So he like, yeah, you the patient, I'm the doctor. I know what I'm doing. I know he had that attitude because my doctor, he's the type of man, he's real sweet. He hugs and kisses me every time I go in there. He's real sweet, but he's the type of man that I'm the man. You don't tell me, I tell you. So I end up having to go into surgery for my foot. And when he took me into surgery, and the surgery came out okay or whatever, and when I came in, when he came in to do my, after I got out of surgery, he always will come, depending on the type of surgery it is and the pain, he will always come back and check on me. So that particular one, he said, boy, classy lady, he said, I went in your foot to do your surgery and the whatever. And he say, I touched one of your bones. He said, your bones start to crumble. He said, your bones start to crumble when I started to do your surgery. He said, wow. I say, didn't I tell you I'm not like all the patients? I said, I told you, you got to treat me with care. When you do something to me, you better make sure you don't know what surprise you gonna get. So, I told him, that was strange to him. He said that had never happened to him. Okay, because I told you I'm not a regular person. I mean, I'm a regular person, but certain things I'm not a regular patient. Oh yeah, good. So you watched the revival, or did you just get the snippet of somebody singing? That wasn't me, honey. I don't carry a tote like a note like that. That's a young girl at church, and when she sing, one time she led a song, and I could tell the Holy Spirit got to her, and she was holding it in because she didn't know what to do. So after that, because I felt when she was singing it, I felt every note she was singing, and the Holy Spirit hit me too. But she had it, but she didn't know what to do with it, so she was holding it in. So after church, I grabbed her and I hugged her. I say, you did awesome. She say, I got nervous. She say, I say, the Holy Spirit hit you, didn't it? She said, I guess that's what it was. She said, something took me, and she said, I didn't know what to do. She said, I wanted to cry. She said, but then I couldn't because I knew I had to finish the song. I said, I said, when the Holy Spirit hit you like that, you let it go. I don't care if you got to cry, put the mic down. Let the organist or the pianist, when they see that, they will pick up and take your solo. I say, but when the Holy Spirit hits you, you can't hold it. I say, it's going to hit you. I say, I knew it hit you because I was looking at you. I was feeling it. And I was like, gone, girl. And I felt what you was feeling. And I said, I can tell you was holding back. I say, next time that happened to you, you don't hold back. You let it go. And so she said, was that what it was? I said, uh-huh. So now, I look at it, I say, let it go. You know, and we had a singer, one of the guys that he's used to singing, he has a good, pretty baritone voice. And he was singing, he led a song at one of the revivals. And the Holy Spirit hit him. And he didn't want to let it go. So after church, we was talking. It was me, him, and somebody else. I said, you know, when the Holy Spirit hits you, you got to move. He said, you know what? He said, I don't know why I be doing that. He said, because the Holy Spirit hits me a couple of times. And I be like, pull back, Tyrone. Hold on, Tyrone. I say, no, Tyrone. You don't pull back, Tyrone. You let it go. I say, so next time you lead a song and the Holy Spirit hits you, Tyrone, you let it go. You don't hold it. I say, because you don't know who you touching in church. I say, you don't know. I say, you let it go and let the Spirit feed. I say, if you can't finish the song, the organist, the director, they know to go ahead and pick up for you and go ahead and do what it needs to be done and finish it out. And if not, if you can't finish it, they can't finish it, or somebody else don't know your part, then guess what? They'll just close it out. I say, but you can't do that. So, yeah. Oh, okay. The weather was real pretty today, BCU. It was real pretty. Hey, Lakeisha, how you doing? Just want to make sure I'm not missing what y'all saying. Y'all all speaking to everybody. I don't have to say who's speaking to who. Y'all can do that amongst yourself. Yeah. So I thought that was strange when I tumbled out again, you know, and so I looked up one of the medications, the new medication, and it didn't say anything, you know, the side effects wasn't anything like that. But when I looked up the muscle relaxer says that it lowers your blood pressure. Well, the other new medication is a blood pressure medication, but it's not the more expensive one that I was on. It was a new one that came out that they say the price was lower. So I say, well, I only been taking it 2 weeks. Maybe it's that. But the muscle relax is the one that lowers your blood pressure, and it can attack, you know, your liver or your kidneys. I was like, oh no. I said, oh, I forgot how long I've been taking it, but I'm not going to take it. And I looked up on it, and I'm reading it. It says all this other stuff, and it says hallucination. I say, well, I be Joan Brown. I said, this medication got me seeing stuff that ain't there. And then here I'm reaching, thinking it's right there. And then I end up tumbling out the bed. So I said, Oh, wow. Hey, I can't say nothing about that prom dress, because mine was about that much too at prom. The good thing about my prom, the guy that I was dating, he was 2 years younger than me. So he went to my prom, and my mama spent about that much for my prom dress. That was over 40 years ago. The material was so much a yard. It was real fancy material. It was a lot for the yard. And then I had a long dress, and it was kind of sheer. I almost looked like I could have wore it for a wedding for a bride. It really was. The way it was made and the way that beautiful lace was, the eyelet, the lace on it. It wasn't eyelet, but it was the lace on it, and it went up here, but the seamstress turned it down, and it went all the way down to the bottom. And the way she cut it out for, up here, and all of this was sheer, and she made me a big old bow. And, oh, it was beautiful. Yeah, we spent about that much. And and then like I said, then when he got ready to go to prom, we were still dating, and I told my mom, I said, I'm gonna wear the same dress. I said, do you think we can alter it? And so we took it, and we had end up having the sleeves cut. For mine, it was long sleeves. For his, we just had the sleeves cut, and it made a big difference in the dress. And when we walked in, his teachers was like, because we were in white, and his teachers, the teachers that was there, you know, doing the tickets and stuff, they looked at me and they was like, wow. They said that dress is beautiful. I got more compliments, you know. So, yeah, and hopefully she could, you know, can wear it somewhere else too. If she get a long one, she might, you know, if she don't gain much weight or it's still some material in it, she can, you know, maybe have it altered. If she start off long, maybe she can cut it short. But yeah, she would wear that dress again if we go into a banquet or a function or whatever. Kendall would be going right along. Yeah, put that dress on. It's not gonna be a one-time dress in the closet. So I was able to wear mine twice. So that was a good thing about it. Um, I don't know what. Oh, and you know what? I end up selling my dress. I end up selling my dress to a young lady that was younger than me, and they saw the pictures. And her aunt, what used to be my old beautician, she was inquiring about the dress, and the young lady was going to prom, and totally different side of town. Well, it didn't matter, but she was going to prom. My dress was still in good shape, and put it in the cleaners and everything, and let them look at it and stuff like that, and the girl could wear the dress, and my mom ended up getting some money back on the dress. So I wore it twice, and we ended up selling it. Yeah, so it didn't go to waste. And that, or you can get it at a can take it and maybe set it to a resale shop once she's finished. But if she starts off with a long dress, I would definitely have it cut, or whatever. Yeah, but I mean, you want to get some wear and tear out of that prom dress. You spend $500 for a prom dress. You want to get more than one wear out of it, and then donate it to the people for the prom dresses. Yeah, somebody bought mine, so I did get wear. I wore mine twice, and then somebody bought it. So even if my mama spent over $500 and I wore it twice, and she sold it like for maybe $150 or $200, she got some of her money back. So yeah, prom dresses are very expensive, are very expensive, and these young girls want to get. I mean, they want to go all out, and at one time the places would have the schools had dress codes. I don't know if they still have dress codes where, you know, certain things couldn't be shown and stuff like that, because these girls get. I've seen prom dresses from, you know, like on Facebook and YouTube, and it some of those are ridiculous. And then I don't know if y'all are the type that's gonna want to have a big old prom party, send off party, and you know that's usually for people that's still there with the food and all that kind of stuff. We didn't do all that. I mean, I know people do it now, but to me, that's a waste of money. It's a waste of money. I rather, when it came to me making decisions and stuff, certain things I did and certain things I say, well, now, mama, we can spend that on something else. You know, but these send offs, and then they got all the balloon, got to have it decorated. And if you doing some of the work yourself, that's fine. But if you got to hire people to do all of that, that's too much. And then they got certain foods, and that's just for the people to sit around and yap, 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 yap. I'd rather you take, mama, you take that money and either get us a limousine or something like that. You know, and a couple of us we put in to get a limousine or whatever. My dad ended up renting a car. He ended up renting a car, but we didn't have a send off like that. His friends came to my house. Um, no, for his prom, his friends came to my house. We took pictures. My mom had some beautiful Victorian chairs. We took pictures and all of that, and that was it. We went to prom. We went to prom. So, yeah, but yeah, that that like I said, that was strange. Um, muscle relaxer that I took, and it said causing a hallucination. So guess what? I took it from my nightstand. I won't be taking it tonight. I won't be taking it no more until I have these injections in my back. And then I'll some of these doctors are so hard to get to and to talk to. You know, I'm just getting frustrated with them. I've never had that before, where it's like so much red tape to get in, to leave a message, to talk to them, for them to call you back. Like my primary care doctor, I left a message on Thursday, and Monday I'm gonna be calling back because I really need to talk to you. I need some things done, and every time I ask y'all to do something, like if I need a referral, it takes so long to get the referrals. It's ridiculous. And when I went in to see you, I told you all of this. I give you a list of who I need a referral to. You already know this. So I don't know what's going on with, I'm getting frustrated, and I'm just to start telling I'm getting ready to start telling them off. Because when the insurance switched me to another PCP, and I was going to the PCP, y'all called me. Now my doctor called me and was wondering what happened to me, why they haven't seen me. I say because the insurance switched me over to somebody else. Now, since you didn't call me and ask me what happened to me, and I said, okay, I'm going to call the insurance and tell them to switch me back to y'all. Now I'm back over here. Now when I need something, you're taking your time to get it. It ain't but a phone call for me to leave you. I've been with you for a long time, but it ain't but a phone call for me to leave you. And you ain't but to drive up. Well, you ain't just around the corner, but you can see me. Because it don't make sense the way these, and I'm pretty sure I'm not the only one. People have problems, just getting through it don't make sense. When I worked for the doctor's office, before I left, if there was a message left for the doctor, every message that we had a book, and each doctor had a color, we would give them a color. Each message in that book that I took for a doctor was answered before the end of the day. If it was a prescription, if they just needed test results, if they needed this, that, and if it was test results, the doctor would overlook them and say, hey, class later, call them back, tell them XYZ. They need this medication, XYZ. That's what I did. Well, that was one of my jobs. That's what I did, and I did it well. And I get on the phone and call the pharmacy and call in that medication, knew what I was talking about, could read the doctor's right, knew how to give it and everything. So I knew how to do that, and I did that. I did my job well. They didn't have a problem with me. And I had maybe 5 docs between 2 people that we would deal with. So it wasn't just like this my doctor, this your doctor. No, it was, if we was back there, we split them. Whoever needed what. Now, the doctor had a preference as to who they went to, and they wanted to handle their business. But if they didn't, whoever. So I was like, yeah, I did that. And I even had one of the doctors that I worked for, his wife was on them drugs. And what she did, strange thing, she called and she knew my voice and she knew who I was. And she also talked to him and said, oh, is that your new nurse or your one of your assistants? Yeah, she does all my phone work and my prescriptions and she does all that part for me, because he had a private practice and he resolved that. So yeah, pillow talk. Yeah, that's who. She handles all my business and stuff. She does a very good job. And then I have one that's on the floor, and she does a good job too. Well, what was happening when he was in private practice, The wife was calling in, well, had him calling in medicine. And then when he, I guess thought she was hooked on him, he told her he wasn't going to give her, any more pain pills. He wasn't going to give it to her. She had to go to, I don't know if he sent her to rehab. I don't know what he did with her. But anyway, and I don't know if that's the cause of his business resolving. I don't know that either, because he was arrogant and stubborn at the same time. He was one of them ones, number one, I'm the boss. Number two, I'm in charge. Number three, you have a problem, see number one. Number four, if you have a problem with any of these, still see number one, which meant he was the boss. He had a little sign like that. So he was, when I say he was arrogant, he looked like Frankenstein. He was tall like Frankenstein and had a square head. If he would have been green, you would have swore he was Frankenstein. But he had a mild voice, and them women loved him. Oh, they loved him. So one day, she called the pharmacy. Whatever pharmacy she used, she called them. She used my name and called in the prescription that she wanted. Ain't that strange? I could have lost my job. I could have went to jail. But she got caught. She got caught because when she called it in, just so happened, by coincidence, I had spoken to that pharmacy. The pharmacy called back, and I answered, and I say, this classy lady. No. Is it another one? I say, no, I'm the only one. They could tell the difference in our voice. She was white, I was black. The pharmacist could tell the difference in the voice. She said, well, I just got a prescription. I didn't just talk to you. I say, well, I'm the only one who answers his phone. I say, I don't care. You can call back tomorrow. I'm going to still be the one to answer his phone unless I'm out. No, I didn't talk to you. And I have a question about this prescription. And I said, well, what is the prescription? She gave it to me. I wrote it down. And she said, the quantity is, I need to speak to the doctor about it. I said, okay. I say, well, who's the patient? She gave me the patient's name. I'm writing it down. Okay. And what's the medication? She gave me the medication. It's a narcotic. I'm writing it down. How did they give it to you? What time did they call it in? And they said, my name? Yeah. I say, they spoke to you? Yeah. But you don't sound like the person that called it in. I say, okay. I'm going to give this to the doctor. And he will call you back. I'm not going to call you back. He's going to call you back. Now imagine getting something like that. Hey, Josh. Imagine getting something like that. And this is your job. And you have the benefit of calling in narcotics. The doctor trusts you so much or whatever. He gives you their DEA code. All this stuff. But somebody calling in using your name. So I'm glad it was on a recorded line. She was on the recorded line. I was on the recorded line. So I was like, this man got this sign on thing that he the boss or whatever. And I said, I don't know how to handle it. I'm not supposed to go directly to him. I called my supervisor. I said, I need you to come back here. I said, I need you to come back here. I need to talk to you. So when she came back there, the other lady had went to lunch, and I explained to her what happened. I said, this is his wife. I said, she called in this medication and she used my name. I said, and the pharmacist said, I didn't just speak with you. She gave the job number and this certain line that she knew I was going to answer. And she said, I didn't just speak with you. She said, is there somebody else with you? I said, no. So I told the supervisor. So I put that monkey on her back. You answer that. I ain't do it. So the supervisor went in there and, like I say, Herman Munster, way big tall. And she little old short thing. She shorter than me. I'm 5'9". She about 5'4". So you can imagine. And like I said, he's kind of arrogant and you know, what he say goes and all of that. So she had to go in there and talk to him. I said, that's ain't me. So she went in there and she closed the door and she talked to him. No, she talked to him and then he said, bring me in there. So I went in there and he said, explain exactly to me what happened. I said, I'm sitting back there doing what I'm supposed to do, doing my work. And I get a phone call. And I said, it came in on the doctor's line, which is a separate line. I said, it came on the doctor pharmacy line. And he said, what happened? I said, the pharmacist said, may I speak to Classy Lady? I said, this is Classy Lady. They say, well, no, I didn't just speak with you. Is there another person there with your name? I said, no. I said, I'm the only one answered this line. I said, I'm the only one. And so they began to tell me what happened. They gave, you know, they said, well, we just got a call and we just need to double check on the patient, verify the prescription. I said, okay. So I said, give me the person's name. They gave me the name. They gave me a date of birth. They gave me if there was known allergies and things of that nature. And then I said, what time did they call? I gave the time. And I told them. I took the information down. I said, I'm going to have to talk to the doctor. I'll give it to the doctor. I said, I'm not going to call you back. He's going to call you back. Because I knew when she said the name, I knew that was his wife. I knew that was her name. So, told him, and he said, thank you. He said, I'm glad you handled it the way you did. You went to your supervisor. Y'all come in here and talk to me. He said, but I will take care of it from here. And I said, okay, thank you. I went back and sat down. My supervisor said, he's going to take care of it. I said, I'm good with it. And then after he took care of it, he came back and he said, he touched me on the shoulder. He said, Classy Lady, I'm sorry that happened to you. He said, that's my wife. And he said, I'm sorry that happened to you. And he said, you won't have that problem out of her again. So I don't know what he did. He called or whatever. But that was a strange thing that happened. And I'm like, you know, I could have lost my job. You know, they thinking I'm calling in narcotics and stuff for people and all this kind of stuff. She didn't call and use my name. Called in her own prescription and used my name. And then gave the callback number to me and think just because she was going to say her name, oh, I was going to say, oh, yeah, I couldn't okay it. And I'm like, you know, and just so happened, a good friend of my mom, and she was a nurse. She was an RN. She was a nurse. My mama knew, a friend knew her. And I wasn't going to say nothing to her, but then I said something to her. And she said, yeah. She kind of, yeah, without saying too much, that, yeah, she was addicted to prescription drugs. Yeah. Go cause me to lose my job. My little piece of job. Yeah. I'm like, man, hey, Kool-Aid piece. I'm like, you ain't, no, that ain't cool. You done lost cool points with me. You done lost real cool points with me. So now, when you call his office and he don't pick up the phone and you call me, the conversation was very short. Short and brief. I don't have nothing for you. Because you used my name and I could have got in trouble. I could have got in trouble with the DEA. I could have got in trouble with my job, him. Then here they come get me. I'm going clank, clank. I would have sued the pants off of him, the clinic, everybody. By the time I would have got out of there. But who wants to go through something like that? Oh, somebody use your name. But I'm glad it was verifiable. And it was verified. And they called back to verify it. And when I got the information, supervisor, I called her, told her what happened. You handle it. You go in there and talk to Lurch. I ain't talking to Lurch. But then after she talked and told told Lurch, Lurch wanted me to come in there and tell him exactly what happened. And I told him. He said, okay, I'll take care of it. So it was done. It was dead. I ain't have to worry about it no more. But that, people do stuff like that. That's strange. I would have never would have thought that in a million years that somebody would do something like that to me. But you never know. And, I was kind of young, but I wasn't wet behind the ears. I knew better. I knew better. Lady, if I wanted to do that, don't you think I would have made money selling prescriptions? Calling in people prescription and say, hey, you owe me $50. I'm calling that prescription for you. Like that girl was telling the other one, talking about Monistat 7, and she the one that needs some Monistat 7. She need more than Monistat 7. What is that she need? Probably need, she needs some amoxicillin. Amoxicillin along with the Monistat 7. And it's another one. I can't think of that one, but it's one that you get trichomonas. Trichomonas. The woman don't know she has it until she goes to get checked by the doctor, and she gets it from the man, and he gets it from somebody that's unclean. I can't think, what is that medicine? Because when a woman gets diagnosed with the trichomonas, the doctor will give her a prescription for 7 days, and then she will give him one prescription, and he has to take, I think it was 4 pills all at once to cure him. But if the woman don't ever go to the doctor, she don't know she have it unless she start really, really having some odor. Yeah. Got some things out there. Some ST, they don't call them STDs anymore. They call them STIs. Sexual transmitted infections. I don't care what this is, a disease. But I guess they don't consider that a disease. They consider that an infection. Yeah. Yeah. Class lady done worked in a bunch of parts. And work with the ladies, I work with the men. I should have seen when the men needed to get them little blue pills. Boy, they didn't want to talk to classy lady. Lord, I got to talk to the doctor. I got to talk to the doctor. Well, when you was in here talking to the doctor, he told you when you call back, you're going to get one of my ladies in the back and you leave them a message. I'm not going to pull the doctor out. Now, you ain't said nothing that I ain't heard before since I've been on this phone. If you can't tell me what it is you want, then make an appointment and come back and see the doctor. I said, who you think calling your prescription for you? You may have went to the pharmacy, but who you think giving you your refills? You got to call me and I got to write it down and for the doctor to authorize you a refill. Or if it's not working for you, whatever it's doing, you got to call me and I got to write it down. And then sometimes I just, would just tell the doctor, look, this man, he's so private, or he think, and then the doctor, he'll get on the phone, he'll talk to him, but he tell him, when you call back, I'm not going to keep getting on this phone. I got other patients I got to see. You don't want to talk to the ladies in the back and tell them what's going on so they can write it down and give it to me and I can look in between patients? Make an appointment and just follow up. Make an appointment and follow up. Yeah. So I done worked with, with all of them. Surgeries, feet, dealing with mammograms, plastic surgeons. I don't think the only ones I didn't really too much fool with was babies. I didn't fool with the pediatric department. That was about the only department I really didn't go in. But yeah, dermatology, I'm trying to see. Kidney doctor, I forgot what that, yeah, but anyway, but strange things, people do strange things. This gonna be the last, pretty much the last one, and I'm gonna get off of here because I got some things I need to do. This man had held his wife hostage for 5 years in their house, upstairs in their room. Held his wife. She was disabled. I don't know if she could walk or maybe had problems walking. I don't know what her disability was. They never said what her disability was. It was on the news the other night. Gloria, I don't know if you're still here, or I don't know if you heard it. Hey, yo, that girl, how you doing? You saw that. Held the wife hostage 5 years in their house, and they had children. So I don't know if he scared them children and say, you better not go to school and say nothing, or what. I don't know if he allowed them to see their mother, or what. I don't understand why he didn't let, I don't know if the children was allowed to see their mother, because I don't know why she wouldn't tell them to call 911 or to tell your teacher. That was so, I was like, I'm still trying to wrap my head around that. And she got away one time, and the police got there, and he was like, wasn't nothing going on, and she was like, yeah, whatever. So the police just blew it off. Held her hostage for 5 years. So this last time, how it happened, he left his phone on the nightstand. He probably went in there to take a shower and got caught slipping. And when she saw that cell phone, I don't know how she had to get it, but she grabbed it, she called 911, and she was talking to an operator. And he came out and he saw it, and he slapped the phone out of her hand. Wrong move, dude. Wrong move. Because when you took that phone and you slapped it out of her hand, and that line was still open, and she may have screamed or she may have said help, and that phone hung up, and then when it hung up, and if the operator called back and they're going to ask to speak to the person that called, the woman. Oh, no, she all right. Sir, I need to speak to her. Oh, she all right. They're up there typing. Next thing you know, you're going to get... Police came. The police came. And they wanted to see the woman. They wanted the person who called. So he had to produce her. So I don't know if she was able to come downstairs. And if she wasn't able to come downstairs, they went into, 9 times out of 10, they called back up. and they had one or more because somebody got to go upstairs, somebody got to stay downstairs, and man, and probably had another one. They probably had about 3 officers out there because it sounded like a disturbance. Yeah. So that was crazy. Yep. By her husband, 5 years. I don't know why the kids wasn't able to say anything to school. Maybe they didn't go to school. But he looked crazier than a road lizard. I don't know. Oh, and he was feeding her eggs. You couldn't give her no meat, no bread. But yeah, it was said that he fed her eggs. That would have been torture for me. That'd have been torture for me. Yeah, disabled. But that don't mean she couldn't walk. That she could have had problems walking. She probably couldn't do some things for herself. But whatever it was, she got across that bed and got that cell phone on that nightstand. So she wasn't too out of pocket where she couldn't. She probably prayed for the day whenever he slipped. And he must have went in the other room or whatever, went to take a shower. Maybe he went to cook her some eggs. And she got a chance to get yeah. Well, he was abusive. Yeah. To just have her in there. So now, I hope they don't even, I don't know if they gave him a bond. I hope they don't give him a bond. But I think they did, I think he did get out. I think that fool got out. But he was not allowed. Yeah, he got out. And if that's the same story, and he was staying with a nephew. Yeah, he got out. Now he's staying. I don't know if he's still with the nephew, but when the story broke, he was staying with a nephew, and he was forbidden. Well, them restraining orders, they are listening, then they don't listen. But he was not supposed to come back to that resident. But like I said, I don't know how disabled she was. He knew the house. He knew how stuff was set up. And I don't know if she got a disability check or whatever. And I'm pretty sure he was, paying the rent or whatever. They may have been leasing or a mortgage or whatever. But that was so crazy. Yeah, but BCU, you be surprised. Them restraining orders, if they want to get you, they get you. They don't care nothing about no restraining order. And then they'll turn around and go to jail because they broke the restraining order. They went over there and murked you and your kids or whatever, and they go on about their business. I mean, they end up going to jail, and in their mind, they don't care nothing about going to prison and serving prison time. They don't care. If they really, really want you, they don't care about restraining orders. And if they have been to jail before or have been to prison, they don't care nothing about that. Nothing. These people go up in the schools, the whatever, just like the army. The guy that was, well, not the army. He was in armed services. I don't know if he was on reserve or whatever, but he was. You could tell that he had been in the service because he had on a uniform. And his wife had just had a baby. They had been having problems. Wife had just had a baby. He got in the hospital with a gun. And I guess went to the room. She had not too much long delivered the baby and went in there and unalived her in the hospital. Brand new newborn. But he got rid of the mom. Well, honey, if you ain't been contacting him and he talking to you, baby, and if you got a restraining order on him, you need to contact the courts, family law, and start recording him. Start recording him contacting you. If he texting you, take pictures and whatever area of you in. If you're in Houston, call the Houston Police Department so they can come out there and take a picture. uh, or if you're in the sheriff's department or constable, call them. Follow up on it. Don't just let it go. Don't just let it go. Now, he knew you was a good woman, but he wanted to be with these other ones. And he didn't want to act right with you. So now the other people ain't doing right. Now he want to do some fallback stuff. No. If you're not contacting him or you're not talking to him or whatever, and you're not supposed to he's not supposed to have no contact, and make sure that the restraining order is not haven't expired. That's another thing. Some of these restraining orders expire and you have to redo them. And some of them, the way they do it is for whenever. Yeah, they can put a warrant out for his behind. And they may not go and arrest him again, but if they got a warrant out for him, they let him get stopped for a traffic ticket and they run him. Oh, you want it. We're going to take you to jail. And then that case gets reopened. But yeah, check to see if your restraining order is still good. You should have the paper. If it's not, you need to go back and refile one. And that may be why he contacted you, because the restraining order has expired. And he feel that he can get in with you. So no. Call him. If you got the paperwork, see when the ending date on there. It has it on there. If it is expired, go back. Or call an officer out to your house. Tell them you need to make a report to start up a new restraining order. And then that way they can, when they do the restraining order, they can get him served and let him know that he's to have no contact with you. No contact. You don't want to talk to him. You don't want to do nothing. And if he contacts you, then you going to, if you have to go put some charges on it. Leave you alone. Hey, Carl. Yeah. Oh, okay. If you don't know your whereabouts, yeah. But like I said, keep it like that. You might need to. How is he contacting you? By phone? Carl, you came over here one time before talking about some big girls and them income tax checks. You need a new transmission. Look, if you're gonna be over here with that foolishness, I'm gonna ban you from my channel. I don't know where the big girls at, but the income tax checks. I don't know. You know where to find them at. Check up in your apartment complex. I'm pretty sure there's a couple of them there. Okay, that's good that he don't know where you live at. Yeah. But how is he contacting you? Is he texting you? Do you have the same phone? Same phone number? Or do you have a house phone? Or is he sending something by mail? How is he contacting you? Is he trying to get through you through children? Relative? She can't get your phone number from the police. They're not going to give her that information. Do you know who she is, her name, and all her information? If you know any of her information, then you need to make a police report. Tell them to go on now. You need to make a police report. And check to see about your restraining order. Yeah. So the police shouldn't be contacting you, telling you that she's calling. The police shouldn't be doing none of that. And if she's saying that she got somebody calling, police don't call you and tell you about some lady calling you, want your phone number. They don't do that. Ain't got time for that. They don't do that. That woman lying. So however she's contacting you or whatever, if she got your number or whatever, you need to be blocking her number, or you need to be taking screenshots of all that information and building up a case on her and him. They need to go on. Now, if she from Nigeria, she need to go on, call Donald Trump on her. Him on both of them. I'm serious. No, you need to make a police report. Yeah, you need to make a police report and have all that stuff documented and printed out and all that stuff. That way, when the police come, they can view all that visual. So when they call the DA, they have to get permission from the DA to get some charges or a warrant or something like that. So you need to have document that. If you got your restraining order, you got text messages, print them out. If you got call log where they calling and the numbers they calling from, all of that stuff. Cause she probably got somebody saying that ain't no police calling and talking about she want your phone number. They don't do that. They ain't got time. They better got time to do their own job, letting no trying to look up your phone number and all that stuff. No. She if you have the same phone number, they can kind of look that stuff up. It's I don't know. I don't know. I don't know if you can go to the cell phone carrier and tell them to put your number unlisted or what. Well, she can stop for him all she wants to. Get her information. Start making a paper trail on her. Is he Nigerian also? Is he Nigerian? You Nigerian? Or did you marry him so that he could, be over here? Or is this somebody he dating now? Cause see, she thinks she can harass you and then go back to her country. I'd get you before you go back to your country. You'll be in there with the Nigerians in jail, in prison. You'll be with the Nigerians in prison in the U.S. You ain't gonna run back. Child, the way my mouth is set up, and not cuss her out so bad. Like one of the content creators say, I cuss her so bad like a dog or for a dog. And I do a paper trail on her. Stop calling me. But I would be recording her. Find a way to record her. I don't care if I'd have to go get a tape recorder from Best Buy. They still sell taping devices or whatever. I had to go get a tape recorder from Best Buy. And when they call, I'd have it right there and say to the recorder, this such and such date or whatever. And then put her on speakerphone. And I'd say, who is this? Or call her name out. Or whatever, is this so and so? And then she said, yeah, you know who it is. I say, well, you on a recorded line, and I'm recording you. You need, document all that stuff. No, I wouldn't. Ain't nobody gonna harass me, and he don't know where you stay at either. And I know it's a lot of people that probably have your number. You better been having your number for a long time. When you got away from him, I would have changed my number then. I would have changed my number then. People don't go around giving other people number unless they get permission. I wish somebody would give out my number and then ask me first. They can't even pull that over on my daddy. Ain't nobody can go to my daddy and say, hey, what's classy lady number? Oh, if you ain't got it, you can give me her. You can give me your number, and I give it to her. Y'all, I don't know why people. I'ma end this live, y'all. I'm Classy Lady. Y'all have a good one, and I'll see y'all tomorrow later. Cause when this call hang up, it's gonna hang me up. So angels on everybody pillars, and I'll see y'all tomorrow around 8. Y'all have a good one.